Natalie,
Currently, 40% of nurses are over the age of 50, and in about 10 years, they will start to retire. Have you seen this in your workplace, and are there any problems with this?
Yes, I've seen that trend, and of course, most of the people that I even graduated with, they looking to, they're just about ready to retire in 10 years because most of the younger nurses come in and within a year or two, they go back to raising their families, and we wind up having like part-timers. So we feel that we've been pretty much overworked. They might just maybe do weekends. Sometimes they will do 2 or 3 days in a week. So we feel like we're doing more, and we're getting really tired. And it's such a bad trend that maybe, I know that they're trying to work on getting some to really have flex hours where they can work around the kids' schedule so that they can really make it to work and not be at home when the kids are actually in school or something like that.
What age do you believe a nurse is considered too old to practice?
I would say that as soon as they hit the 60s, they really do feel especially the ones who are really running up and down the hospital halls and trying to give meds and do that. They're not able to keep up because they wind up having, they're starting to have arthritis and, joint issues, mobility issues. Some have dexterity problems, and it makes it real difficult for them to really work efficiently. They tend to not want to do the hectic work. They want to be pretty much in doctor's offices and nursing homes.
And does the aging workforce compromise patient safety?
I don't really think it compromises patient safety. I mean, they pretty much really, I think the age group, they tend to do lightweight stuff, so they really don't, they actually more, they're able to keep up with everything else, I think the safety, they actually, I think they more helping with the safety issues, and as a matter of fact, trying to correct the younger nurses in terms of what they're doing, so I think the safety-wise, they really, that's the number one issue, so they tend to be really, really more into helping out to prevent those issues from happening.
Okay, and how does age factor into the advancement of nursing?
I think the age issue, in terms of advancement, I think that if we can really get the younger ones to really, once they graduate, if we can get them to stay in the profession a little bit longer before, or maybe just work whilst they're still raising their families, it will be, but the advancement issue, I feel that in my case, I'm looking forward to retiring, because I'm tired of working. And I've been doing it for 25 years, I'm just tired. It's just like, you get to a point. But with what I do now, I just with agency, so I don't really do much. I tend to send the nurses out, but it looks like I'm really ready to really put everything down. I'm tired.
Okay, that was the last question. Thank you.